why do we close things down anyway? And how should you make a decision as to whether or not you should be opening things up? And why does having access to testing matter so much anyway? I feel like this has all become sort of ambient noise. But this is a really specific idea. It's not a hoax. You know, it's not a trap to make you give up your guns or something, right? It's a rational system that makes sense in light of a highly contagious viral epidemic that kills people. You need for people to not have so many contacts with other people, so that when a person does test positive, they've had, say, 3 contacts that need to be traced, and then themselves need to be tested, and then they need to be isolated if they're positive. And then their contacts can be traced as well. You need people to have like 3 contacts, or 4 or 5 or 6. But if your community has not been closed down at all, if there aren't mitigation efforts in place to keep people from having lots of contacts with other people, if you've got no controls in place in terms of limiting people's contact with each other, then every infected person you identify turns out to have not 3 or 4 or 6 contacts you need to trace, but 30 or 75 or 150 or 300. How many people were at that party? How many people were in that bar? How many people were in my workplace with me? I mean, lots of whom at that point they can't even identify. That's then too many to trace. And that means there's too much virus in the community to meaningfully get an outbreak under control, to meaningfully work on it, to find any one outbreak, to track down where it has spread to stop it from just radically, exponentially, freely increasing its spread beyond anything public health efforts can do to trace it. There's a reason we closed down. It was not because being home is a nice place to hide. It was because being home means that you don't contact that many other people. A, so that the virus spread slows, but also B, when it does slow, you can grab it. You can grab it. You can get your hands around it. You can intervene in a public health way to stop this thing from running off like a block of buildings on fire now threatening the whole city. I mean, opening up for no reason, or for reasons not based in science, or for political reasons that had nothing to do with health, when you didn't have the epidemic small enough to monitor and manage any new outbreaks, that was a recipe for disaster. And now we're living through that disaster. Right? And the bad decisions are still being made. The vice president and president scheduling indoor rallies right now, right? Governors like Pete Ricketts in Nebraska forcing the repeal of existing mask requirements. I mean, stuff like this shows that it's possible, even now, even when we're at over 40,000 cases a day, it's possible that we are still making the most disastrously wrong decisions that we have made of this whole epidemic. Not we made bad decisions before, but we're still making them right now. And you can see these disasters manifest all over. Texas is in a real pickle right now. We're going to take a close look at Texas this hour. It is not good news. In Houston, in Dallas, in Laredo, in Waco, in Corpus Christi, in San Antonio, it is bad news in Texas right now, and starting to look like urgently bad news that could become a national level problem, because Texas is such a big state and their epidemic is so out of control and their hospital situation is so bad. California, the most populous state in the nation, just hit their biggest daily case number today by a mile. The LA Times headlining it as the state obliterating its previous record. In Southern California, Riverside County ICU capacity is now at 99% full. Arizona blew through its daily case number record today as well, just shattered it. Alaska, Georgia, South Carolina, Oklahoma, California, all hit record case numbers today. It was 2 weeks ago today that the vice president, who is supposedly helming coronavirus policy efforts for this government, 2 weeks ago today, Vice President Pence wrote his op-ed calling our coronavirus experience a cause for celebration as a country and a great success story. 2 weeks ago today, he wrote that op-ed. Today, we are at 40,000 cases plus a day and headed for 100,000 cases a day, according to Dr. Fauci. I mean, if you have been waiting to break glass in case of emergency, we are there.